Hello everyone and welcome to today's podcast. Our topic is telemedicine, transforming healthcare and education in a digital era. My name is Jaden and I will talk you through it. Imagine this: in a rural village, a child develops sudden breathing difficulties late at night. The nearest hospital may be many hours away, but in minutes, her parents connect a pediatric specialist through a smartphone and the doctor, through video conferencing and data from a wearable sensor, guides them through immediate steps while arranging transport to a clinic. The child's life is stabilized, not by being in the same room as a doctor, but through telemedicine. This simple example highlights what telemedicine can do to break barriers of distance, save lives, and make healthcare accessible when and where it is needed the most. Today, I will be explaining its history, motivations, technologies, applications, challenges, and future directions based on three major studies. Why does telemedicine matter? During the COVID-19 pandemic, the hospitals were overwhelmed. Thus, telemedicine became a lifeline, where patients could receive care without risking exposure to the virus. It reduces cost and travel burdens, particularly for rural and undeserved communities. It also expands medical education, giving students hands-on experience with remote consultations and digital tools. After all, telemedicine isn't just a matter of convenience. It's a fundamental to making healthcare resilient, equitable, and innovative. History and evolution. Telemedicine has a surprisingly long history. In the 19th century, the telegraph was used to report battle injuries, and by the early 20th century, physicians were transmitting ECG data across distances. By the 1970s, pioneers like Murphy and Bird conducted thousands of remote patient encounters, proving the feasibility of telemedicine. The internet era and mobile devices accelerated its adoption, making telemedicine mainstream by the 2000s and is indispensable during the COVID-19 pandemic. Technologies and communication protocols. Modern telemedicine relies on a wide range of communication technologies. These include Zigbee, Bluetooth, Wi-Fi, satellite links, and now 5G networks. Protocols such as TCP/IP ensures real-time data transmission. Wearable sensors and body area networks allow continuous monitoring of vital signs, enabling doctors to track their patients remotely with high accuracy. Applications in patient care. Telemedicine has improved vital in patient care. During COVID-19, it provided triage, chronic disease management, and reduced hospital congestion. Patients with asthma, diabetics, and heart failure showed similar outcomes whether treated in person or via telemedicine. In emergencies, satellite-based telemedicine supports disaster zones and remote regions, ensuring that care reaches even the most isolated populations. Telemedicine in medical education. Medical schools are increasingly integrating telemedicine into their curriculum. Students participate in simulated patient consultations, ethics courses, and communication skills training through telehealth platforms. Universities such as Nebraska and Oregon Health and Sciences have embedded telemedicine into their clinical assessments, preparing students for digital-first healthcare. Beyond clinical skills, telemedicine also teaches leadership and communication, essential for modern medical practices. Challenges and barriers. Despite its promises, telemedicine faces significant challenges. Typically, there is a lack of standardization in medical data formats and device interoperability. Policy barriers include reimbursement gaps and inconsistent regulations across countries. Socially, the digital drive limits access in rural areas, While some patients prefer face-to-face care, privacy and security concerns also remain, as patients may use unsecure devices or networks. Adaptation is further slowed by limited awareness. Many patients don't realize telemedicine is available or prefer their own provider. Future directions. Looking ahead, telemedicine will integrate artificial intelligence, Internet of Things, and big data for predictive healthcare. It is expected to expand in elderly care and nursing homes, offering continuous monitoring and reassurance. Strong regulatory frameworks and reimbursement policies will be needed to ensure sustainability. Hybrid models that combine in-person visits and telemedicine will likely dominate, balancing convenience with personal connection. Ultimately, telemedicine will continue to break barriers, making healthcare more accessible, affordable, and effective. Telemedicine has grown from a niche experiment to a central pillar of healthcare and education. Its journey from battlefield telegraphs in the 19th century to AI-powered platforms today shows how medicine adapts alongside technology. Each stage of process that has been made, whether radio, telephone, or through the use of the internet, has brought us closer to a world where care's no snowbound. The COVID-19 pandemic was a defining moment. Telemedicine kept the hospitals from being overcrowded, protected very vulnerable patients, and ensured continuity of care. It provided that remote consultations could deliver outcomes comparable to in-person visits, especially for chronic conditions like asthma, diabetics, and heart failure. Beyond patient care, telemedicine also became a teaching tool. Medical schools integrated virtual consultation, ethics discussions, and communication training, preparing students for a future where digital fluency is as important as clinical skills. However, challenges persist. Inconsistent reimbursement policies, concerns about privacy and security, and a digital divide limiting access in rural or low-income areas. Patients often prefer face-to-face interactions, and providers have to learn to build trust through a screen. In, in any case, these obstacles have the potential to become opportunities for innovation. With stronger policies, better infrastructure, and continued investments, telemedicine can be a universal tool, not a privilege. In the future, the integration of AI, wearables, and big data will make telemedicine even more powerful. Virtualized predictive systems that can warn doctors in advance of deterioration in a patient's condition, or hybrid models that mix in person and remote care for maximum convenience and connection. This will be particularly effective in elderly care and nursing homes, promoting safety and dignity through continuous monitoring. At its core, telemedicine is not about machines, it's about its people. It's about making sure no patient is left behind because of geography and circumstances. It's because training doctors can be compassionate and digitally fluent. And it's all about building a healthcare system that is resilient and inclusive and ready for the future. Telemedicine doesn't replace medicine, it expands it, building a bridge between patient and providers, classrooms and clinics, past traditions and future innovations. In that bridge lies a promise of healthier, more connected world.